very pleasant Tuesday morning. It's time for Money Info, brought to you by Princeton Research. Got to get a hold of that newsletter. Every weekend comes out with Mike King and Charles Moskowitz. Mike King in Las Vegas, Charles Moskowitz up in lovely Beantown. And guys, very pleasant post-Thanksgiving to all of you.
Thank you.
Yeah.
And Greg, I had the most relaxing Thanksgiving because I rented a house over on Martha's Vineyard, and I knew there was going to be no Wi-Fi. When I got there, it turned out the cable box was dead, and so I spent 5 of the most relaxing, unplugged days that I can remember. It was really a pleasure to not have, anything going on.
I love it.
Really terrific.
I think that's wonderful. Oh,
yeah,
man.
Actually, it really was very restive. Anyway, today we have Peter Alex on. He's from Skyline Medical, and in the last several weeks we've had the CEO, Dr. Carl Schwartz, on, who gave us an overview of the company and their products. And then we had 2 other gentlemen, Bob Berenger and Richard Gabriel, who are doing a venture with Skyline that involves disaster relief and mobile hospitals. Peter is their vice president in charge of sales, and the company last week, on a very quiet week, received Canada approved their product there. So without further ado, I'd like to introduce Peter Alex, and he can tell you about what that means to Skyline. It certainly meant something to Skyline's stock, which traded up about 120% after that announcement was made last week.
Yeah.
So, Peter, feel free to talk.
Hey, that's
Thank you for that.
Great news, Peter.
Thank you for the warm introduction. It is great news. No, we're pleased to be with you this morning.
But now, what have you done for us lately? That was last week.
That was last week, yeah. So we went through, in the United States, we went through the Thanksgiving holiday, but as we move our sights to Canada, it's going to be a busy next several weeks. We're excited about the opportunities to get into Canada. I had a conversation with several people over the weekend with regards to interest in our product, both from a distribution standpoint as well as hospital health systems in Canada. So, the license release was timely, and we're expecting it to yield some pretty good results for us at Skyline.
Peter, we have new listeners all the time. Tell us a little bit about Skyline Medical.
So Skyline Medical is a medical device company. We're located in Eagan, Minnesota. To this point, we've been a U.S. manufacturer that's only distributed in the United States. So with the Canadian health release, so we're excited to go international, and we're expecting much the same in terms of global expansion into Europe in the coming months as well. Skyline Medical manufactures the Streamway system. The Streamway system is a fluid waste system that's used to collect, dispense, and measure infectious fluids in procedures and then take those direct to drain. So that's the piece that makes us really unique, in that direct to drain is such a novel and innovative product in the marketplace. It replaces out moving systems as well as canister and various glass evac bottle systems as well out there.
Well, and I think the big thing that I was so impressed with, being a layman, is just the safety of everyone in an ER.
Yeah, anytime you can mitigate risk for staff or patients, I think that there's always the need for a discussion and a significant interest with manufacturers like Skyline Medical and our product. Our product is simple in that we go straight from the procedure right to the unit, and there's not a lot of human contact, with infectious fluid other than a single-use filter that's disposed of and disposing of suction line in a traditional way. So we definitely are bringing a novel solution to the marketplace. In our reach and interest in the hospital health systems has gone much further than end users. It's now there's an interest with environmental, environmental departments, infectious disease departments, and other sorts of clinical biomedical engineering departments, as well as facilities that now say this is maybe a system we should be looking at.
Well,
Peter, just a curiosity. I don't know if you'll know or not, but when we had Bob and Richard on last week or the week before, they were talking about using the tissue trap to do diagnostic work. Is that part of the system that has been approved in Canada, or is it just the waste system so far?
So the tissue trap is part of what might be future plans for Skyline Medical. In terms of Canada, right now we are taking our current system generation to the market in Canada, the same one that we're currently FDA approved at in the United States. And so we are just focusing clearly on infectious waste fluid removal at this point. So that'll be our early entry into the marketplace.
Great. Thanks.
I would think, especially like the CDC or other federal agencies, would just be all over this device.
Yeah, we feel that anytime we have a conversation in the marketplace with regards to this product, eyes open up. They really, really do. I think that these canister systems that are out there, we have the ability to really control some things, reduce the risk, cross-contamination, and many of the patients that come into the hospitals, you don't have an early diagnosis, or there's no infectious disease known for that patient sometimes when they come into the emergency room, and this just gives physicians and clinicians a much easier way to reduce that risk.
Wow, it's a phenomenal story. But okay, so what does a Canadian door do for you internationally? I mean, will this help you guys in the Eurozone, in the Pacific Rim, or what are you looking at?
So the Canadian health market operates pretty independently of itself. Our ultimate global expansion will occur through a CE mark, and that is still pending at this point. So we're still following that through. But in terms of the Canadian health market being a single-payer market, there's the definite need for finding savings. Much like the U.S. market, their cost of healthcare has continued to rise since 1970. Just like in the United States, not to the same degree that the U.S. market has, but with the single-payer system, they're just as conscious of price as in the U.S. market. The difference is that they typically use a request for proposal option to purchase versus the more traditional purchasing methods used in the United States. So we'll be involved in more proposals, looking at it from a health system standpoint. And their needs will be to look at it both in one single department as well as likely to standardize across a particular health system. So they're very global in terms of their thinking, in terms of bringing a new product in. And they're definitely looking for savings, not only up front with the product by way of saving with the Streamway system, but also what I like to call that downstream savings, what it can bring to infectious waste, environmental, and all the various factors that Canada is extremely interested in as well.
Peter, does each province have its own medical system, or is this, one gigantic Canadian health system network?
Well, I mean, from a federal payer standpoint or from a single payer standpoint, it's all one system. But provinces tend to have a lot of, I would call it singular responsibility. For example, Quebec, there will be distributors that we look at that may just be singled out for specific provinces because they're very familiar with local law, local administrators, local health systems, and things like that. But there is the ability to carry over once you get into a health system across the broader Canadian marketplace. And so we're looking at this as both almost very similar to the United States in that it is both where we have state-run and federal policies that affect things, as well as local, what we call IDNs or GPOs in the United States. They have local health systems as well that tend to create partnerships or alliances with other health systems across the system. So It's very much so a similar sale to the United States in that we need to approach it very similar, but we'll be looking at a variety of distributors to carry this part out.
Yeah, okay. Well, that makes perfect sense on a sales side. Then it's just like, dealing here in the United States, where you obviously you have the federal system. Each state has their own system, and then comes all the way down to counties and sometimes even cities have their health systems. So yeah, I would imagine you're going to need specialized distributors, to say the least, especially if you're talking the French side of the equation and the eastern part.
Yeah,
well, it's got to be easier than it is here, where you have literally different within the state, different different hospitals, parts of different groups, different surgical groups operating. Where there are a lot of private customers.
That's true.
As opposed to, somebody who is aggregating it for a province or for, a number of provinces or, on the federal level.
Yeah, that's true.
Our system is so fraught with, individuals with individual interests that I would think Canada would be, a much easier place to be able to make sales or to generate proposals, let's say.
Yeah, well, it's a perfect example,
outside
Charles.
Of the VA.
Yeah, go ahead, Peter.
No, I was just going to say, outside of the VA, which is more of our federal type of program, the Canadian health system is kind of governed in a very similar way to that. So we look at some similarities there. But, there's differences in terms of coverage, across state lines versus coverage there is automatically covered as a single payer. But we have health systems that are expanding beyond their borders right now and are leaving their local regional municipalities and are becoming more global, across multiple states and things like that. And now through purchasing organizations are looking to do a lot of aggregate purchasing in the United States. So we're looking at a lot of these common components to kind of overlay into our strategy into Canada as well.
Charles brought up a point in that, we have, as a matter of fact, a bone talk show, orthopedic surgeons who have their own surgery center here on the Treasure Coast. So, yeah, I can understand how it's not just the governmental agencies, but it's, just getting the word out to all the folks. Do they have, say, orthopedic specialists, heart specialists, do they have their own hospital situations, or are they all part of the government system? I just don't know the Canadian Health Network.
Yeah, in terms of the Canadian health market, I think they operate very similar in terms of their facilities. They tend to operate more on a hospital network. So services are offered and provided more through the hospital system than in the United States, which tends to have more outpatient facilities,
right,
like you're referring to. So we're approaching it more in line with our hospital strategy.
I actually have to introduce Peter to Gary Cella, whose wife is a surgeon, and he offered, because he really liked the first time that he heard the company interviewed with Dr. Schwartz. He called me and said, I think I could really be of help here. His wife is a surgeon, and they're down in western Connecticut. And he was telling me his wife operates through a group that is part of 3 other hospital groups, one in Stamford, one in Westchester, and one in Westport or Greenwich or whatever. So he's talking about substantial practices who operate from within the hospital system there, but they kind of run their own show, which is, it has to make things more difficult. And he may be helpful introducing to those groups, but then the groups have to go to the hospital, and then the hospital has to go to the group who runs the hospital, the partnership group that runs the hospital. Canada sounds like shooting fish in a barrel compared to what it takes to get something done here on that level.
Yeah, in the U.S. market, there's a lot more in terms of private versus public partnerships that are out there. And in the Canadian market, it's going to be more like a direct dealing with one sort of entity. So that's what makes the U.S. sale a little bit more complex. But we're still bringing the same value proposition to Canada as we are in the United States, reducing infectious waste, value in reducing costs, and a variety of other strong value propositions that make Streamway so unique.
Peter, what are you looking at numbers-wise, the numbers of distributors? Obviously, Canada, a large country, but really spread out geographically.
Yeah, so the Canadian market, you can find distributors that cover all of Canada, or you can find distributors that focus just on their provinces or a certain region. And, we're looking for someone who has the right fit, for Skyline Medical, someone who's going to be dedicated to distributing our product, getting it into the right departments in the hospital, and people that are positioned for a sale that is a capital sale as well as a disposable sale. So in terms of the number of distributors, that is going to be determined here over the next several of weeks. We're in strong conversations with many distributors right now, and we're just excited about the opportunity. The interest, as soon as we made the announcement that we had approval, was exceptional all across Canada, all the way from the Atlantic to the Pacific.
Yeah, that really sounds amazing. And does the fact that, you've got these in some very prestigious hospitals, to say the least, down here, does that carry much weight north of the border?
I think it does, and I think that the reason why some of these big health systems in the United States have purchased Streamways is because they believe in the product, and it provides all of the value that's here. That same value is going to occur at a university setting in Canada as well, and there's such a need to standardize across these health systems, and oftentimes it occurs at the university level down, and then it kind of trickles down into the system that feeds these university hospitals. So, you would hate to have one level or standard of care at one hospital and then have a different standard of care at another hospital. So I think that's where the real interest is going to come from the university hospitals in terms of cost reduction, reducing the risk of infectious waste, and just all the benefits that the Streamway offers.
Yeah, I mean, you've got McGill that has just such an amazing reputation north of the border for research, and I'm sure there are a lot of others. I know that when I was doing a lot of television stories up in the Alberta area, whether it was Edmonton or Calgary, there seemed to be a lot of research going on out there as well, and of course BC as well. So, yeah, I would imagine you could really get your foot in the door up there.
Yeah, it's one of the things we're looking at doing with clinical research is, it's whether you're pulling out infectious fluid or just surgical fluid, or whether you're pulling out ascites fluid, which is in two different procedures. One is called a paracentesis, and another is pulling out fluid from a thoracentesis. These are procedures that fluid needs to be tested. It needs to be done properly, and the continuous infinite flow of the Streamway system just allows for so much more streamlined, patient throughput, from getting fluid in to getting it out to getting it out and disposed of properly. But the scientific research regarding fluid is where there is such great interest right now, both in the United States and in Canada. I'm guessing it's going to be much the same. So that fluid needs to be tested. It needs to be determined for various bacteria. It's used for oncology purposes and things like that. So, we're interested in partnering with Canadian hospitals that are interested in doing research regarding the fluid collection. Most definitely.
Yeah, and as Charles mentioned a little bit earlier, the prospects down the line of being able to, say, sample some of that, instantly and do biopsies. I mean, my goodness, that. You talk about saving not maybe more than months, maybe years of testing by utilizing that function.
Well, and Carl said that too. He said, the biggest risk in some of these situations is doing what they have to do the first time and not. I know that this doesn't pertain to the Canada portion of it yet, but he was saying how important that tissue trap and all of that other testing is, because you don't want to find out 4 hours or 2 days after you've had somebody in surgery and close them up that you have to go back in and open them up again. So the fact that you have something available there that you can test, even if it's just the fluid, while the patient is laying there on the table, to have access to it in a sterile environment makes all the difference to some people.
Absolutely. Even the pathology fluid testing, it traditionally can take 2 to 3 days to get a result back. And, we bring the ability to increase that exponentially to maybe even down to the time where a patient is still in the procedure or perhaps even still in the hospital, where further treatment can be done versus a patient going home. And I'm referring just as much, whereas Carl was referring to a surgical patient, these are outpatient procedures where a patient comes in, they conduct a normal paracentesis or thoracentesis, which takes like an hour or two, or a colonoscopy, which takes, an hour or less, and they're able to get the results back before they leave the hospital, or maybe even intra-procedure. So that's where we're terribly excited about the ability to bring this testing more in terms of real time versus more post time.
And no matter what, I mean, whether it's colonoscopy or whatever it is, we're all uptight when we go in for those tests.
Mm-hmm.
So, if you could somehow pull that off, where you just by the time you're done in the waiting area, that they could have, preliminary results would be phenomenal. I mean, that's
how big is the system, Peter? I mean, how many hospitals, how many, locations could there possibly be?
Well, I think that, when you look at this, you have to look at, roughly, there's 10,000 operating rooms across Canada. So, our goal is to make introductions not only in the operating rooms, but also in the outpatient procedure rooms in which we have, we began to capture. So, I think the goal of any sort of launch in a country would be to spread that launch across the provinces and really get a fair representation across Canada in order to bring true savings across. And I think that's the biggest value we bring is really trying to have a concentrated effort, just so we're not all on one side of Canada in terms of the initial launch, but really find ourselves, across a variety of health systems across Canada at this point.
And just so that people understand, when you said that the next step forward would be the little CE, why don't you tell the listeners what that actually stands for and means to us?
So the CE mark is the European approval mark that's used for medical devices, and a rigorous approval process is done, much like Canada Health did recently for our license in Canada. So what that will open up is broader access to distribute the product into Europe. And then the CE mark worldwide is also accepted in countries like Australia and New Zealand as well. So that broader acceptance will open us up to global marketplaces that Skyline has currently never been. And we are looking forward to doing that, some part in the first part of 2017. We're hoping that we can pull that through, and that'll be a nice springboard off of our Canadian announcement, which just came.
Wow,
that's great!
What a great story!
It's a great story.
Yep.
And it's one of the. It's not a story that at this time of the year that's gimmicky or a slave to fashion or a holiday story. It's a good, solid company being built around a fairly universal need. I mean, this thing is not going out of style next year.
Sure. Yeah. No, it's Peter, how do we find you on the web?
you can find us at skylinemedical.com, and our website is full of a variety of videos as well. So, if there is a patient out there that is concerned with, how a loved one might be managed over the holidays, or if they have an upcoming procedure, our website provides some video on our product, which is very informative. I think it can show both end users and patients really what our product can deliver, and we're excited about the possibilities to bring this to patients as well. And I think that's the true benefit, is coming back to the patient, and that's really one of the focuses that Skyline has right now.
That sounds great. And yeah, I was watching some of those videos when we first got together a few weeks back, and you've got an amazing story, and now you've added another chapter to your book here, and congratulations on Canada, and keep us informed.
Thank you. No, I appreciate that. We will, and thanks for having us today.
You bet.
Great.
All
Thanks.
right. Charles, I think
Yes, sir.
You've hit a home run with Skyline.
Well, that's what Mike and I have been trying to do, all along. We find these little companies that are niche players, and they're emerging companies, and clearly Skyline is one of those. Market's kind of just hanging around here, not really doing very much of anything. The S&P is down about $6. NASDAQ is down about $12.80, and the Dow, which was down about $80, $70 at the open, is now down 0.22%, so about $40, $41. Not really doing very much of anything, and we'll just Mark Cola, COLA, will be joining us from Sigma Labs anytime now. And Sigma is also kind of an early stage publicly traded company that deals in quality control software for 3D printing. Another, strong emerging technology.
Oh, you bet. Our local, I'll tell you, our local college, Indian River State College, is very much into 3D printing at their incubator. And, I mean, there's aircraft companies around us. Of course, one a very large one just south in West Palm that utilizes that technology. So, it's phenomenal. I heard a bell. Mark, are you with us?
Yes. Good morning, Mark Kohler.
Perfect.
There you go. Okay. Well, it's
Okay, so I think that I've already given Mark an introduction. Did you hear that, Mark?
I did, yes. I just joined. Thank you very much.
That's
Okay,
great.
Great. So I've told people what you generally do, and I'll let you go into your previous life's history and what this company does.
Well, thank you very much, Charles, and thank you for the opportunity to speak with you all today and tell you a little bit about Sigma Labs and who we are and what we're doing and where we're going. And so Sigma Labs is an early-stage company, publicly traded on the OTCQB under the call letters SGLB. And the principles of Sigma Labs came out of Los Alamos National Laboratory here in New Mexico, up in Los Alamos, New Mexico. And we principally are working in the area of quality control software, as you mentioned, for advanced manufacturing technologies, just like 3D printing, and specifically in the area of metal 3D printing. So you've heard for a number of years about plastic 3D printing and, of course, its widespread use. And now the emergence of 3D metal printing over the last several years, and with high-profile companies like GE Aviation and Honeywell Aerospace, they've ratcheted up a bit and taken it to the next level. And so they are now at a point where quality control and quality assurance matters are becoming quite critical for them as they bring new products and new designs to market. And in steps Sigma Labs with a quality control software that allows them basically to assure the parts quality as they're making it, as opposed to traditional manufacturing, where you typically have the inspection step separate and after the fact of making the part. And Sigma Labs has worked quite hard over the last several years to bring this software to a commercializable state where companies as the ones I've mentioned are evaluating and using this technology to assure the quality of the parts as they're making them. And so we're quite pleased to be working with the companies I mentioned, and principally what we found, Charles, is that the early adopters for this technology, of course, as you might expect, are in the aerospace sectors, followed very closely by the biomedical companies in this space. And so companies like Siemens and GE Aviation and Woodward, who is a Tier 1 supplier to aerospace, have adopted our technology and are using it to evaluate the parts as they're making them.
Of course, I wasn't going to mention the name, Mark, of the huge aerospace company in West Palm, but it's Pratt & Whitney. They're right down the road.
Pratt & Whitney, yes, of course, a large aero engine manufacturer.
Yeah, it's just this is
so
phenomenal.
They are, of course, like others, in the early adoption phases here and evaluating these technologies. We're working with Aerojet Rocketdyne, a former Pratt & Whitney company down there in your neck of the woods, and they're, of course, looking at 3D printing for rocket engine components, very critical components, as you can imagine. And so as they're 3D printing their parts, they're evaluating our technology in terms of making sure that they're getting a good, solid, high-integrity part for these performance-critical applications. So we're quite excited to be working with them on some programs.
That's phenomenal.
Well, you knew that things were getting a little bit more serious as opposed to the novelty of 3D printing when they sent one to the space station 2.5 years ago.
Exactly.
Sure.
And so and of course GE Aviation has been quite prolific in their announcements with respect to their efforts on their next generation LEAP engines. With they're printing a fuel circuit nozzle that has a very complex internal geometry, which are proprietary to them, and of course they have to assure that every layer as it's being deposited is of the highest quality because it's a critical component in the jet engine.
Look, the world is proprietary to GE. No, I'm sorry.
Yeah.
But now, you talk about space. The first name that comes to mind, who's right up the road here, Elon Musk. I mean, is there a possibility that these private space companies would be looking at this as well?
Oh, they certainly are looking at and evaluating these metal printing technologies, and SpaceX in particular has been utilizing this technology for some time, and so they all start out the same sort of way. They find as low a non-critical component they can start with and begin printing, and then as they build confidence and understanding in the 3D metal printing process, well then of course they move on to more complex designs and more critical components.
Wow, this is amazing. And I know, of course, the local college here, I mean, they've got courses in all of this now, and it's because obviously this is going to be the new workforce, you know?
It's really interesting when you think about that, the new workforce coming out. And so the engineers and scientists graduating today are getting, a flavor, if you will, for this technology, but it's the future generations coming out that are really going to sort of help propel this, because they're going to be coming out of school with a whole new design philosophy, if you will, for thinking about the creative parts that can be made when you're not restricted to the usual sort of traditional metalworking technologies of casting and forging, where you can only have certain sort of geometries and shapes. And this opens up a whole new organic space in terms of the design aspect for 3D printing.
Wow, it's an amazing field, and you come from an incredible place. Los Alamos probably has a worldwide reputation of developing, goodness knows how much. That's just in Los Alamos, New Mexico. And
absolutely, and Los Alamos was at the forefront of this technology in the late 1980s and early 90s. They developed some of the seminal patents in this area, and that's the group that I came from up at Los Alamos in the Material Science and Technology Division, where they actually invented some of this 3D metal printing technology that is still in use today. And so they very much are forward-thinking and pushing the envelope, and of course that's what we expect from national laboratories, is them to take on these sort of grand challenges. And that's where Sigma Labs got its start in terms of the whole QC technology and the ability to couple, if you will, or put together the manufacturing step with the inspection step such that they become one. And of course, we all know that Deming, back in the day, basically acknowledged the need to do this. Of course, he was much ahead of his time, but nonetheless, it applies today. And so Sigma Labs and the principals started this work at Los Alamos National Laboratory, where you can imagine we work with very critical materials and components, and they require the utmost precision and accuracy and the ability to inspect, where appropriate, the part that you're making. Just made the whole life cycle, product life cycle, much more complete, if you will. And so if you think about 3D printing now, where you're taking an actual 3D computer-generated file and you're downloading it to a machine tool, and the machine is now building up the article out of metal powder and using perhaps a laser to melt the metal particles together into the shape you want, the precision, while is there in terms of the machine's ability to produce it, you need to have an independent measure of the quality. Because for those of us that have worked in the traditional manufacturing, we know that you don't necessarily inspect an object or a part with the same set of calipers or yardstick, if you will, that you made it with. And so you need that independent measure. And that's where Sigma Labs software technology comes into play, because we're third-party and platform-independent quality assurance for your parts. And so as a result of that, we were able to complete, if you will, the digital thread from design concept all the way through to the end of the product's life cycle. So we offer a complete solution set in terms of our software to assure the part's quality while it's being made, and then during the product's life cycle to ensure process repeatability and consistency.
I don't know how many years out Musk was talking, but he was talking about a 3D printed car that,
Oh, yeah, sure.
That's not out of the realm of...
It's really an interesting concept. And of course, you see many examples in the press today where at the moment you might see someone say, well, we 3D printed this car, or we 3D printed this motorcycle or bicycle. And what they've done is really interesting, and in terms of they've 3D printed the individual components and then still perhaps assembled it. But to your point, yeah, won't that be exciting when we can 3D print the entire object?
That's amazing. Did you, when you were working at Los Alamos, I mean, I've always been fascinated by that place. I used to do a lot of University of New Mexico basketball and football games. And just the thought of, did you ever, when you walked through the front doors, have kind of gee whiz moments at all the stuff that was being conceptualized there?
You know, just about every day. It was really fantastic place to work. There's just exciting people, and the technology that's being developed and innovated there is really inspiring, and quite honestly, on a daily basis.
That is amazing. But what you have done then, what you've taken really with the software, have taken 3D to a whole new level, where you don't have to wait. I mean, you're basically the software is working both sides, if you will.
Well, and also, Greg,
that's a really good point. And so just to put a fine point on that, for example, some of these critical components that are being 3D printed today, for every dollar that is being expended printing them, there's about $4 to $6 extra dollars being expended to inspect them in a separate step. And at that point, you've already either built the part right or you've built it wrong, in which case then you've added additional cost to inspect it to find out either A, it's good and you did it right, or B, you did it wrong, and now you have to try and figure out what, because in the current traditional approach, inspecting it after the fact, it's only a snapshot in time, and it really gives you no insight into what's going on with the process. And that's where Sigma Labs technology is, and again, coming out of the #1 physics laboratory in the world, we have a great understanding of the physics of what's going on with the process. And so when we look into a process and we understand what's happening there, as I mentioned, we can complete the puzzle pieces and connect the digital thread from design all the way through the end of its life cycle. So the engineer, the guy on the floor that's making these parts every day in and day out, he gets from our software, if you will, a microscope into his process such that he can understand on a layer-by-layer basis what's happening with every part that he's printing.
Wow.
And you know, Greg, another way of looking at this is that once, you almost have to, in Mark's case, you almost have to invent or perfect the tool that's going to look for the quality control, because the tolerances are changing so dramatically. I mean, if just to use extreme hyperbole in reverse, it's like you used to get on the scale, and the scale had, a line for every pound. And you'd jump on the scale, and you'd look at it, and if it was somewhere between 175 and 180, and you didn't have your glasses on, you could say, oh, yeah, I weigh about such and such. Now, you get on a scale, it's digital, it recalibrates itself when you put your toe on it to all zeros. You get on it, and it comes up with 174.6 to tell you what it is. And so when the tolerances become like that, the measurements for quality control of the tolerances have to be increased, probably, a factor of that. Correct, Mark? I mean,
well, you actually make a really interesting point and about quantifying the data, if you will. And what Sigma does in terms of the precision and the accuracy is that it's just not a qualitative measure of the quality, if you will. It's actually a quantitative measure. And so we can put an actual number on the quality, working with a specific customer, help them define, if you will, their control points, such that they can then begin to, over time, trend their process. Because as we all know that these are mechanical systems, and like any mechanical system, your car is a good example. I mean, it wears out over time and you have to replace certain components. But with our technology, now you get a whole predictive measure of the machine, independent predictive measure of the machine's performance, and it's quantified to the point where now you can begin to start having predictive life cycles for maintenance schedules and downtime, such that now the productivity issues just almost go away, and they increase, as you said, on a quite a growth curve. And so our customers are finding added value from this software technology, where it's not just collecting data for data's sake, and we all collect data. Everybody listening is collecting data on us right now. But the question is, what are you going to do with it? And that's where Sigma Labs differentiates itself from its competitors. It's to your point, understood the basics and the fundamental physics of the process, have been able to quantify and put precision on it, and allow our customers to take action with that, such that everything they're doing every day becomes not just an exercise in a manufacturing exercise, if you will, but it becomes an exercise in statistics, if you'd like. And so for all those statisticians and manufacturing engineers in listening, is they understand that over time their machines are going to wear. They have to trend that and watch it, and then predict when they need to take machines down, such that they don't lose productivity. And that's a big gain for our customers when they realize that it's possible to do that with our software.
Yeah, I just read the first half of Thomas Friedman's new book called Thank You for Being Late, and he talks about the explosion in data and the way that it's being used by manufacturers. So everybody knows that, they have their car, they're used to their car. When they hear a sound, they know that there's something off a little.
Well, exactly. That's right.
But he talks about how in something as simple as a washing machine or a dryer or a refrigerator, that they have built so many sensors into these things that the data hears something that you could not even perceive. And if it's connected, it sends the message, in 1/100th or 1/1000th of the time before it becomes the issue, that you could even tell at which point you would possibly need a serious repair, but absolutely be alerted that there is something going on. And your quality control, as stated, is, even more extreme than that. We're not talking about guys looking through, a magnifying glass at a piece of metal saying, oh, yeah, this one looks okay.
You really hit on a couple of interesting things, if I can sort of ferret them out a little bit, Charles. The whole concept about hearing, if you remember, and Toyota took this to the nth degree, if you will, but this whole concept of lean manufacturing back in the day, when first there was Six Sigma technologies, and then there was lean manufacturing technology, and that was all based on learning to see. It was a visual methodology where you could walk into a factory and you, within 30 seconds, can understand what's happening at every step of the way because it's all visualized for you. And so Toyota, basically took hold of this and revolutionized an industry, if you will. And now if you think about Sigma Labs technology, it's not learning to see, it's learning to hear. And you're exactly right. And there's many analogies where, the simplest thing back in the old day, if your car was making a clunking noise, well, you might be able to tell it's coming from the engine or the back end of the car or the tire. But now with the sensor technology, and it's ubiquitous, they're everywhere. And so to be able to deploy the right sensor is the first step in the process. And Sigma Labs does that for our customers. We know what sensors to deploy and place onto a machine such that we're learning to hear what's going on with the process. And And the next step then, of course, is the monitoring of that data that you're collecting from that sensor. And then the real key, and where Sigma Labs' intellectual property resides, is in taking action with the data and making it actionable such that the manufacturer that's making parts every day, day in and day out, is able to buy and accept his own product before selling it on to his customer. And the other point you made, which I wanted to touch on, is without first, touching on the sensing and the monitoring and the analysis part of it, which Sigma does, without that, you're not able to go to the next point, which you just made, which is closing the loop, now making it self-controlling, where the machine tool is able to sense, monitor, analyze, and then take action with it in fractions, if not milliseconds, reaction time. Now, that's a bit further down the road, but Sigma Lab is laying the foundation for that type of closed-loop control technology of the future.
Now, Mark, I know Charles would usually ask, what about competitors? Is there anybody else in your space?
Well, absolutely, and we're aware of them, and we welcome them because it helps us feel real assured that we're in the right space, and they come from all sort of walks of technology right now. There are academic endeavors to push, basic science and research in this area, which, of course, we're always keen to stay apprised of and aware of. And then, of course, there are smaller competitors. But then again, quite honestly, there are competitors in the even at our customer level where they're trying to help push the technology front, if you will, to achieve new positions. And I think I just wanted to touch on something there about customers. And so when Sigma Labs says customers, it really breaks down into three sort of categories for us. There are the original equipment manufacturers that are making these 3D printers today. And of course, what they'd like to do is have software like ours, if not ours, embedded in their machines such that when it's delivered to a customer's floor, it already comes packaged with our software inside. It's sort of the Intel Inside model. So that's a target market for us, and we're very active in that right now. And the other, of course, are the end users, the customers that Sigma has now, the GE Aviations, the Honeywell Aerospace, the Siemens, and Aerojet Rocketdyne. And so those end users are the folks that use these machines to make parts. And then, of course, you're going to have end users like a Boeing that they just assemble planes. They don't want to necessarily make the parts, and they have a vendor or a supplier base. And right now, that supplier base is a burgeoning area for 3D printing. And so you're starting to see a lot of mom-and-pop sort of startups as the industry sort of forms itself around this vendor base. And so there's sort of the three categorical areas that Sigma's focused on.
Wow. Yeah, I'll tell you. You got
here.
Yeah.
Mark, you want to give people the web address so that they can look at the site? And we are going to actively cover this company.
Yes.
And so you will be hearing much more about it.
Yes, certainly. And thank you very much for the time today. And you can visit our website at sigmalabsinc.com. That's sigmalabsinc.com.
Wow. Mark Kola, thank you so much for being with us on Money Info, brought to you by Princeton Research with Mike King in Las Vegas, Charles Moskowitz in Boston. What an amazing show. This is really a 21st century show today. Wow. We'll be back. See you next week. Aloha.